Hello, I'm Dr. Frances Pitsillis. Migraine affects 22% of women and 8% of men. And it is probably one of the biggest causes of misery and poor productivity and loss of money in our community. Why? Because the pain is severe, people need often a lot of time off work, and the patient has to spend money seeing the doctor and buying drugs to relieve their problem. So what can we do about migraine, and what is it that is behind migraine? Well, we often can tell if the person has problem with foods, and I would recommend avoiding gluten, milk, yogurt and ice cream, and then any other food that you know you react to. Is it peanuts? Is it red wine? Is it bananas? Is it strawberries? Is it fish in some people? Is it beef in some people? Is it soy in some people? In addition to food, hormones are an important influence, particularly in women. It's not surprising to find out that some women get migraine for the first time after menopause, and it only improves when the hormones are treated. Or more commonly, many women get their migraine before their period, and that's because in the premenstrual time there isn't enough progesterone in the second half of the cycle. And it's not surprising that also at that time women are more anxious, are not able to sleep, get more depressed, and they can often get heavy periods, and that's all from not having enough progesterone. And then I also think about the neck, because it often starts at the back of the neck if it doesn't start over one eye or on one side of the head, because it can overlap with tension headaches. So very often it can start at the back, the front, or on one side. So is it stress or is it tension? It's probably all in one, because stress causes tension. And in that case, looking at the situation and looking at stress management is important, but also looking at magnesium deficiency. So what can we do about helping people with this serious disabling condition of migraine? Apart from the things I've already mentioned, it's important to get enough sleep. In addition to the diet that I've mentioned, we want to know that the person is adequate in terms of their nutritional status. So I think a good multivitamin, possibly a B complex on top of that so that we can get the Bs, because we know vitamin B2 is important in migraine. We know that magnesium is important in migraine, and you never get enough magnesium in a multivitamin. And some people may want to look at trying coenzyme Q10, which is not a vitamin, but it's a supplement that helps the energy in the cells. Apart from progesterone, what other hormones can you consider? Well, if you're not sleeping well, you could consider melatonin. Melatonin is called a hormone because it's secreted by the pineal gland, but it actually is made in your own body from your food. But a lot of people have found it helpful for sleep and for migraine. Sometimes herbs can be useful. But in the end, we need to use drugs for those very difficult cases. And short-term, non-steroidal anti-inflammatories can be good, but you need to be careful about your stomach. So you must have them with food. And if your doctor gives them to you long-term, you need to take a protective medicine with it. You can take paracetamol and codeine type medications, and you can also take abortive treatments like sumatriptan. However, these are far more useful if you can get in early or if you have an aura. But remember, only 30% of people have an aura. And then there are other medications that the neurologist often can give you. If the migraine is unusual or very new, I think it's very important for you to have this checked and possibly even have a head scan to make sure there isn't anything serious going on that we don't want to miss. And lastly, what innovative treatments can you have that may be of some use? Well, if we know specifically where the headache starts, botulinum toxin can be used in the areas where the headache starts and can last for 3 months or longer. In my clinic, I like to try and get rid of that headache without botulinum toxin, but it's good to know that I've got it there for those very difficult cases that need a break at the beginning, and also the ones that are very resistant to treatment. So now you know all the things that I can think of that you can do for migraine, one of the most disabling conditions in our community.